Jai Shri Krishna Badane.
Shri Krishna.
Can everyone hear us? Okay, fabulous. So we'll just wait a couple more minutes for a few more people, if that's okay.
Right, I'm back.
Fabulous. We're just waiting a couple more moments for everyone to get into the room.
No, right, that's fine. Are you doing a live event? Is this live event in London as well?
Not at the centre, no.
No, it isn't. Okay, all right, just wondered.
Okay, Badane, Jai Shri Krishna, I think we'll start now. So just a few.
Oh, somebody in the chat. Yeah.
Namaste, thank you.
Yeah, don't worry, I'll keep adding people in, so you carry on.
Perfect.
Thank you. Right, just a few housekeeping rules. This talk is being recorded. So if you are on this someone's screen sharing has taken over from me.
Oh, hang on, what's happened there?
Yeah, how's that happening?
It says
How's that?
Chandni Mistry.
Chandni Mistry screen.
View options. There we go, that's better. Let me try screen sharing again. Okay, can you all see our screen?
Yes.
Brilliant.
Fabulous. You can hear us as well, no?
Perfect, yes.
Okay,
Brilliant.
thank you. Right, we'll start again. So Jai Shri Krishna Badane, just a few housekeeping. So this talk is being recorded. So if you are on the call, you are consenting to being recorded. Also, this talk is also only for educational purposes only, so we won't be giving any medical advice or any individual advice over this call. And throughout the presentation, we will be having some conversations, asking some questions. So do please put your answers or any questions you have in the chat. And right at the end, we will have the question and answer.
Brilliant. Perfect. So Jai Shri Krishna Badaina, મારું નામ Dr. Chandni Jadavji છે. This is Karishma. આજે અમે તમારી સાથે stroke ની વાતો કરવાના છે. So today we'll be running through what happens in a stroke. So stroke માં શું થાય, stroke ની signs and symptoms શું છે, and if you have a stroke, what to do about it. We will try our best to speak in Gujarati as much as we can, but our Gujarati is not perfect. So if we say anything wrong, please maaf karjo.
Thank you. Okay.
Brilliant. Move on. Yeah. Perfect. So why are we talking about stroke today? Stroke is one of the biggest diseases that affects many people in the UK. There are 100,000 strokes each year in the UK alone. Now, when we look at strokes and when we look at South Asian population, so that's like us, Gujarati, anybody sort of from India, Pakistan, Bangladesh, etc. Strokes actually, well, South Asians actually make up majority of stroke deaths in the world. So 40% of all stroke deaths, so that's nearly half of all stroke deaths in the world, are actually or affect South Asian people. So that's a really, really big number. South Asians are also at a higher risk of stroke and at a risk of having a stroke at a younger age compared to other populations. So say a South Asian might be at risk of having a stroke at the age of 50 or 60 compared to another ethnic group like white population that might have a stroke at the age of 70 or 80. So it's really important that we try as hard as we can to prevent as many strokes as we can.
Okay. તો આપણે ગુજરાતીમાં માણસોને stroke ના risk વધારે છે in comparison to બીજા જે ethnic minorities, whites, etc. તો આપણે ध्यान રાખવાનું કે જે વસ્તુ કરી શકાય to reduce stroke નું risk. આપણે try કરવાનું દિવસમાં every day, try and reduce the risk, and we will show you and talk to you about કેવી રીતે કરવાનું, શું કરવાનું, ને તમારા risk factors શું છે.
Okay. So now I'm going to ask everybody a question. Stroke tamari body ma kya effect kare? To kya thai stroke ma? Does anybody know?
Please put anything you have in the chat, or you can put your hand up. Thank you, Sheila, for your comment. You're welcome to put your hand up if you'd like to speak, or if you'd like to say anything.
Does anybody know where it affects? Yeah, exactly. There we go. Lovely. And the reason I ask this question is because sometimes when I speak to my patients, some people don't know where a stroke actually happens. I know a lot of people have put the right answer in the chat. So correct, it's the brain that it affects, and a stroke the brain matai. But some people think it happens in the arm or the leg or the heart. So it's really important to know exactly where it happens. And you're right, it happens in the brain.
So what is a stroke? As you can see from the picture, this lady looks very, very distressed. Model one-sided body chair. So a stroke is an interruption of the blood supply to the brain. So if your brain doesn't get any blood, doesn't receive the oxygen or the food or the nutrients it needs, and so your brain cells can die. This is a medical emergency, and it is a condition that you need to call 999 for.
Okay. So in Gujarati, stroke atle tamara brain sudi tamaro lohi na poche. And tamara lohi na poche to tamaro oxygen na poche, because oxygen lohi ma hoi. If there isn't any oxygen and oxygen na poche, to tamaro brain slowly marva mande. It gets damaged in that area. And if that happens, then you can have problems with your hands or problems with your arms. So it's a medical emergency, and straight away hospital pochi javano, because we need to treat you really quickly. So when we think about stroke, we want to think about the main types of a stroke and what actually happens in a stroke. Yes, we said that there is a problem with blood getting to different parts of the brain, but how does that actually happen? So there are two main types of stroke. We won't go too far into this, but this is probably enough for you to understand. The most common type of a stroke is known as the number 1, which is on the left-hand side, which is an ischemic stroke. And in this type of stroke, there's a blockage in one of the blood vessels in the brain. So this is normally a blood clot or like a cholesterol deposit or something like that that causes a blockage in that area in the brain. This then means that blood then can't get past that point. And as you can see in the blue area, that's the part of the brain that is getting damaged there. Yeah, Karishma's just pointing to it now. That part there is starting to get damaged because there's no blood supply in the white blood vessels in the brain. So this is the most common type of stroke that you will see. But then in number 2 is a hemorrhagic stroke. And I think somebody in the chat did mention that they had one of these types of strokes. I'm really sorry to hear that you suffered from this. But this is, again, one of, oh, sorry about that. This is, again, it's not as common, but it's when you can get a bleed in the brain. So this is most commonly happens when there's been a rupture of a blood vessel. That means a blood vessel has popped in the brain and it's no longer going via the route that it should, and it's just there's a bleed in the brain. So again, this can be very dangerous again, but it causes the same symptoms as you get in an ischemic stroke.
Okay, so just go over it again in Gujarati. So બે જુદા types of stroke હોય. એક ને બે on the screen છે. એક એનું નામ ischemic stroke. એ તો the most common type of stroke હોય. Ne a blood vessel, as you can see picture ma, blockage hoy under. Ne blockage hoy to loy farini sagai under brain ma. And so the brain cells ma mari jai. So with that one, that is the most common. Ne biju and nam hemorrhagic. Tama blood vessels fati jai ke pop thai jai ke to loy badu brain ma jai. Ne matha ma jai ne pressure build up thai under then matlab me brain ma problem thai ena lidhe.
Yeah.
Now there is another type which is called a transient ischemic attack, so just over here, and it's also known as a TIA, which if you know anyone that's had this, sometimes you get doctors or nurses referring to this. It's also known as a mini stroke. This is where the blood supply is cut off to the brain. So like before, we showed this is the healthy artery, this is the unhealthy artery. And this from here is all plaque. This is all cholesterol deposits. And when this gets narrow, it can block the actual blood flow. Oh, sorry, let go. This can last for a couple of seconds, minutes to days. So it's not like a full-on stroke, but it is a warning sign for a full stroke to happen. And this is when alarm bells should be ringing and you need to get checked out immediately.
Okay, so Gujarati ma try karo. So ત્રીજો type of stroke બી આવે અને આ stroke નું નામ છે TIA એટલે mini stroke એટલે nano stroke. Same symptoms, motor stroke સાથે છે, so same symptoms that you will have, okay? But the difference is કે આની symptoms એક દિવસ માટે જ last કરે. So sometimes it can last 1 minute, ke 2 minute, ke 1 kalak mate, but it shouldn't last more than 1 day. So that's the important thing here. Okay. Tamne nahi khabar pade ke you're having a mini stroke compared to a motor stroke because the symptoms will be the same. So you have to do the same thing. Okay, tamne straight away any symptoms aiva hoye to tamne hospital pochi jawano. You have to call 999 or go straight to the hospital if the ambulance is taking too long, because sometimes the wait is a bit long nowadays for an ambulance. So if you have somebody that can take you there, tamne sida tya pochi jawano. A TIA is really important because sometimes thorak symptoms ave and we think, okay, we're all okay and have pacha normal thai gaya and we don't need to see the doctor. But that's wrong, okay? Because tamne ava symptoms aiva hoina even for a minute or 2 minutes or 1 kalak, you still need to go straight away to the doctor because it's a warning sign that you might then have a big stroke in the future. The warning sign check that tamne motor stroke may be thase in the future, and it's really important that you treat it exactly the same. So straight away hospital pochi javano. And again, so this is what we were saying, 999 either call kari nakhwano, get straight away hospital pochi javano, whichever one is faster. Okay. If tame ekla hoy to 999 call karo and elaka ke elaka jaldi aase, that's fine. But biju koi hoy ne garma and it's saying the ambulance is saying ke ek kalak lagse ke be kalak lagse, then go straight to go straight to A&E and elaka ne okay, I think I'm having a stroke. They will see you quickly.
Okay. And the other thing is when you do get symptoms, so the symptom hoy, we'll talk about the symptoms in a minute. It's important to note the time. So if you're at home with someone, the goro hoy gog satene and elokana stroke na symptoms hoy, to time lucky nakano panchwage thiu, panchwage modu thiu, because that is very important. And we will talk about why.
Okay, so this is probably the most important slide in our presentation, and I want all of you to spend a good amount of time looking for it and learning it. Okay, it's kept quite simple so that hopefully you remember it. Okay, so this shows you the main signs and symptoms of a stroke. So one word that I want you to remember is fast, F-A-S-T. So F, face. So what I want you to remember is F meaning face. So face means, has your face fallen on one side? Or if you're looking at somebody else, it might not be yourself. It might be a family member in the room or one of your friends that you're sitting with. Have you noticed that their face has fallen on one side? Can they smile? Are they able to feel what's happening on that side of the face, or can't they feel it anymore? That is one of the main signs of a stroke, and it's one that is probably first noticed. You might notice a droop on one side of their face. You might notice that they're drooling or their spit is coming out. So that's one of the main signs. Then you've got A. A stands for arms. Have you noticed that one of the arms is drooping on one side? They can't lift their arms above their head. That's one of the main important signs as well. Or have you noticed that, again, either yourself or somebody you're with can't feel their arm? It doesn't feel the same. It feels numb. That's one of the other main things. Okay. Then you've got S. S stands for speech. Speech means, is their speech slurred, or is your speech slurred? Are you finding it hard to talk? Are you finding that you can't say things that you would normally say, or it's not making sense, or that the person in front of you is not making sense? So your brother, sister, friend, they're saying something and it sounds like they're talking gibberish. You're not understanding what they're saying. That is also a sign of a stroke. Okay. T. So if you've noticed that their face is drooping, their arms, they can't lift their arms, or they're not able to speak properly, then it's T. It's time to call. Straight away, call 999, or like I said, if the ambulance is saying it's going to take 1 hour or 2 hours, the best thing in the hospital is say 5 minutes away. If you can, and if you can transfer them to a car, straight into the car, okay, and go straight to the hospital, because that's going to be the best thing. And like Karishma said, I want you to note down the time. That's really important, because if you note the time the symptoms happened, the doctors that you see in A&E will be really thankful. And the reason for that is the treatment that you can get depends on the time that your symptoms happened. So if you get to the hospital within 4 hours of when the symptoms first started, there is different treatment that you can have. They can give you a treatment where they can break up the clot, the blockage in the brain. But if you get there after 4 hours, you might not be able to have that treatment. There will be other treatments, but maybe not that one. So it's really important that you go straight to the hospital as quickly as you can.
And I think one of the important things on this is, Abrama, we can be quite scared to speak up, can't we? And say, oh, it doesn't feel right, or something. So it's hard, I know, but if you feel something that isn't right, please always raise it. especially these sorts of things. If you see and think something isn't quite right with someone, to dhyan rakhanu ke, oh, am thai che na, khabar nahi kem, but you can always call for help. So just to go through it again, Gujarati ma, apro modu ne joanu, ek side thi pari gyu hoy, to joanu, oh, as you can see, picture ma, ne pelo slide to ne lady no picture and modu ek side thi pari gyu, and મોઢામાંથી પાણી કે ઓલું આપણે saliva હોય એ નીકળી જાય તો એ ધ્યાન રાખવાનું. બીજું arms કે હાથ આપણો, hold on, you see this way, હાથ આપણથી ઊંચું નહીં થાય from here. I think you can see this bit. So and એક સાઈડે આપણો હાથ પડી જાય, so એ ધ્યાન રાખવાનું. આપણો ભાષણ, આપણો speech is not right, slurry hoy ke kai samajh nahi pade, manas વાત કરે ત્યારે એવી રીતે sound થાય. Ne lastly, સમય no very important. તમે doctor ને phone કરો, GP ને નહીં, 999 તરત જ કઈ right નહીં લાગે તો તરત જ phone કરવાનું. મન લાગે phone ઉપર મને લાગે કે આ માણસને stroke થાય છે, આમ symptom છે, ને એ લોકો તરત જ help કરશે તમને. ને જે symptom થાય ને ત્યારે તમારે time જોવાનું ને લખી નાખવાનું, because તમારા symptoms ના લીધે જે time હોય ને, only certain time થી કદાચ થોડુંક treatment મળે, નકા તો એ તો treatment નહીં મળે ને બીજું treatment મળશે.
Exactly. And I think one thing to add as well, like exactly what Karishma was saying, is none of us want to go to A&E. I know it's not a nice place to be because the waiting times are so long right now in the NHS. But even me being a GP, it's hard to sit in A&E sometimes, but this is what A&E is there for, okay? This is what it's there for. It's there for heart attacks. It's there for strokes. This is the only place that you can get treated for all of this. So it's really important to go. I know there might be a waiting time, but strokes are acted on very quickly. Okay, so if you are having a stroke, 999, going to A&E and say they're having a stroke, they will act on it quickly. Okay, you will be put into a priority. So please don't hesitate to go.
On that as well, when we talked about the mini stroke and a full stroke, you won't know the difference between the two unless you get a scan and the doctors review it. Is that right?
Yeah, definitely. The reason being is because, say, when we mentioned a mini stroke, sometimes the symptoms can last 1 minute, sometimes it can be 1 kalak, sometimes it can be 2 hours, sometimes it can be 24 hours. Anything lasting longer than 1 divas, 1 divas, it means that that's not a mini stroke anymore, that's a stroke. Okay, but you hopefully, if you get to the hospital quick enough, your symptoms might then go away after an hour or so, but you will still be treated in the same way because we won't know that it's a mini stroke versus a stroke. So same thing, if you notice any symptoms, go straight away. So now we are going to talk about the complications of a stroke. So we already mentioned before of what happens when you have a stroke. You know, where there's the blockage in the brain and the blood doesn't flow through to the rest of the brain and then you get damage. If you get to the hospital quick enough, hopefully we can try and reverse and break the clot. Okay, so that's why, remember I was saying there's different medication and there's different treatment if you come before 4 hours of the symptoms. Sometimes what happens is even if we break that clot, there can still be damage that's done to the brain. It's not always permanent, and sometimes you can try and regain some of that function. We'll talk about that a little bit in terms of how we can do that. But sometimes you can be left with some complications of a stroke, depending on how much of the brain is damaged. So some of the main complications of a stroke can be, on the left, we're starting, physical effects. Sometimes you can have muscle weakness, tamara hat pag na kaam kare, You can have problems with swallowing. એટલે તમારો ખાવાનુંમાં problem sometimes થઈ જાય અને તમારો swallow તમે sort of certain ખાવાનું ખાઈ ના શકો like you used to be able to before. You might notice that you might have changes in your vision. એટલે sometimes તમને properly દેખાય ના or janku janku દેખાય. You can even have problems with your balance. એટલે something that you used to be able to do before, like you might have been able to stand independently and stand properly. You might not be able to do that anymore, and you might need assistance. એટલે sometimes some people might need a lacquery, Zimmer frame, or something to help them move. And one of the problems that I think a lot of us would find hard if it does happen is bladder and bowel problems. એટલે toilet ni problem, because sometimes you might lose control over your bladder and bowels, or તમારી toilet ni problem થઈ જાય અને તમને control ના કરી શકો. This is hard because, you know, we all like to be independent. We all like to clean our own selves, and we don't like anybody else to do it because it can be hard. But sometimes this can happen as well.
Okay, ne upper biju complication hoy stroke no is communication. We like to speak, we like to, you know, express our own view. Sometimes manas ne stroke taine elokane speaking upper bhasha, talking can be quite difficult. Life after a stroke can be very different. It might not go back to what it was previously. So forming words and words sometimes people can't put the sentences together. So it might not make any sense, or it might be random words that they're just saying out of their mouth. And also the person that's experienced the stroke might not be able to understand you. So you might be speaking in Gujarati, English, and we might have to speak slower, dhiraj, asteti, vat karanu, so they can absorb and listen and take it in. And the lastly is memory loss. Sometimes when the brain cells die, apre bhuli jai vastu ke o am kairu pela 5 varas pela ne they can forget, and that's as a result of the stroke.
And then the last one that we wanted to talk about is mood. This one, me and Karishma thought is probably one of the most important ones that we wanted to bring up with all of you here today, because I think Apravara, we find it really hard, and in our community, we find it hard to talk about our what we call mental health and our mood. Because sometimes we think, you know, we think we're strong and but that strong chair, and we just get on with things. But that we'll go on, we'll do our tasks. But cleaning everything by ourselves, and we just do it. We just get on with it. But when you have a stroke, like we were saying in Karishma, that you can have these physical symptoms. Sometimes your hands don't work anymore like they used to. Or like I said before, toilet ni problem thei jai sometimes. And sometimes that can be really hard. We can all find that hard because you might have to have family members looking after you. And that can be hard for you. It can be hard for your family member because you think, you know, imagine if your daughter is now having to look after you, you might think, I used to look after you, and now you're having to look after me. So that can be really hard, and it can make people feel really low. Sometimes they can get affected with depression, anxiety. Sometimes you don't feel like you want to do anything anymore. You don't want to leave the house. You don't want to go out anymore because you think how everyone's going to have to look after me, and I don't want to burden anybody. You know, everybody has to look after me. But this is really important to talk about, and I'm sure that your family members will want to know. Your daughter will want to know, your son will want to know how you're feeling, because it affects them too. And it's really good to know, to be open with everybody and know that this is a complication of stroke. And it's not just that everybody's having to look after you. Actually, there can be a part of the brain. So the front part of your brain is what we call the frontal lobe. That's one of the ones that can help with it. It affects your emotions and it affects your personality. If you've had a stroke there, that might change the way that people are. It might change your mood in things. It might make you angry. You know, kai gomena, it's not the same as it used to be. And it can just be a pure complication of a stroke. So it's really important to say.
It can also affect your personality. Some people have had strokes and they've come out and that can be quite distressing for the person, but also their family. So such things like you know, the suicidal tendencies or panic attacks, this can all happen from the trauma response of having a stroke. And it's just to say from both of us that these things do happen and they are real, and it's okay to feel those things and it's okay to get help for those things.
And if you do feel like that, there is all of us to speak to. So you can speak to Karishma as your pharmacist, you can speak to me as your GP. Your GP will want to hear it. I know sometimes it can be hard to get an appointment at times, but we are here, okay? So do try if you can and get a hold of us and let us know that you're feeling low. Because now a lot of general practices, so my general practice speaking personally, there's mental health practitioners that are attached to this, and we can give you real good advice. Okay, we'll talk a bit more about that later as well. So now we're going to move on to talking about the risk factors for a stroke. So we've spoken about, and I'm already of what the signs and symptoms of a stroke. Tamne sukarano hoy, tamne stroke out hoy to go straight to the hospital. Now we want to tell you a bit about what puts you at risk of a stroke, and maybe how do we then work on all of these to prevent it from happening? Because we don't want a stroke to happen in the first place. So we want to try and as hard as we can to stop this from happening. So I'll start with one at the top, and I'll start with obesity. That's our vajan. We want to really try hard, because with you being overweight, if you are overweight, especially around the tummy area, okay, this can be really, this puts you at a high risk of having high blood pressure, high cholesterol, diabetes. It puts you at all of this risk. So we want to really try and cut that down, because that increases your risk of a stroke greatly. Okay, so we want to try as much as we can to lower that weight.
Okay, now biju jaya lack of exercise. So exercise got it. So that will help your the more heart, the more lungs, and the more circulation strong thai. So exercise ni kore, never there stress. So that's not good for us. So 30 minutes of exercise or brisk walking, that's nice. Get some fresh air, circulation thai. And also remember, a lot of people have desk jobs nowadays. So they're sitting at home or they're working from home, and they will sit for hours and hours. If you do have this sort of job, remember, stand up, utwano, move your legs a bit, walk from here to the toilet and back. And that will also help.
Because if you, again, with the desk-based jobs, not moving around much means you're going to put on more weight, and mainly around the central part probably, and that's going to increase your risk as well. The next one is sleep apnea. So sleep apnea is a condition where you might notice tame or tamara partner, tamara husband, wife might be doing a lot of snoring in the night. And a sleep apnea thai when you have pauses in your breathing. Yes, heavy snoring, but you might notice in the breathing at night, tamara breathing stop thai. And you won't realize that, but your partner will. So that your husband or wife will probably notice, or even your daughter or son will notice, dad was breathing, and then he's snoring, and then he stopped snoring for a good amount of time. That is a risk of sleep apnea. And you might find that you might be really tired throughout the day after that, because you end up waking up a bit more in the night, but you might not know it. We can save that for another talk properly. But what the reason we brought that up today is because sleep apnea, if that happens to you, it puts you at a higher risk of blood pressure. Blood pressure ni risk hoi sleep apnea sate. And a blood pressure ni risk hoi to tamari's risk of stroke is also higher, because if the pressure in your blood vessels is high, you might be more likely of a rupture in the brain as well. Okay, so although hemorrhagic stroke and even ischemic stroke, blood clot knee risk is higher. So it's important to notice that. And if you see signs of that, see your GP.
Now, if we go down a bit further, heavy alcohol use. So man kaba bada ne brandy pawe, ne whiskey pawe, ne gin and tonic, ne wadu. So, but within moderation. Apre wo piwa jai to numb emotions or feelings, or because stress, hoy garma ke kame ke eu badu, that can also increase your risk of stroke. So reducing the amount we drink per week will also help your liver and help your circulation.
Okay. And then the next one is smoking, cigarette smoking. I hope ke koi cigarette na pita hoy in this group, but if you do, please try and stop. Okay, there is a lot, or stop or reduce the risk of this, because this doesn't only increase the risk of stroke, it increases the risk of so many conditions. Okay, so it increases the risk of everything that you see on the list. It increases the risk of diabetes, of problems with the heart attack knee risk, cholesterol knee risk, blood pressure knee risk. Everything is increased with that. And one of the big ones that's not on the side here is cancer. It really does increase the risk of cancer. The cancer knee risk goes up a lot. So it's really important to really try and cut this down as much as you can, because it's expensive as well, more expensive to use cigarette smoking. So try and cut down, and then you can save money to go elsewhere. There is anywhere in England, England, Wales, Scotland, in the UK, there is help with stopping smoking, and it's called the smoking cessation team. Okay, if you just put into Google smoking cessation or stopping smoking, there is lots of details on it, and they can help you to try and stop smoking.
You can go to your local pharmacy as well.
Exactly.
Local
Yep.
pharmacies do stop smoking
Mhm.
support, and you can go in and they do like a weekly kind of check-in, depending on the pharmacy. And just to add to that point, with the alcohol and the smoking, it makes your blood jikro, like sticky. I think that's the word, isn't it? Jikro.
Yeah.
So that's why all of these things to stop it is important. And on top of that, if you are going to stop smoking and you are taking other medicines, just be careful. Just get some advice from your doctor or your pharmacist, because it can affect the way your medicines work. So just be cautious of those things. And now, Abra, we go on to the diabetes. Diabetes can also increase your risk of stroke. This is if you have either type 1 or type 2 diabetes. So be aware of that. The high blood sugar, so abraloima vadare sugar hoy, it can cause damage to the blood vessels, which then can create a clot. Clot bani jai abra blood vessels ma, ne brain ma jai, the brain ne stroke thai. So dhyan rakhanu, abra diabetes ma kabu ma rakhanu, and seek the support we need.
And Roma Ben was telling us that you had a talk on stroke, or not stroke, sorry, on diabetes earlier this week, I think it was, wasn't it? So I hope that was good. And I hope that you've learnt ways to sort of prevent diabetes if you don't have it already, or to control it a bit better as well. The next one on that list is cardiovascular disease, like heart attacks or cholesterol deposit, tamara blood vessels ma. This again, abadu, it increases the risk of stroke. Okay, so it can make tamara heart attack take then it can sometimes make you at risk of your heart beating in a different way, in a different rhythm, and then it puts you at risk of having a clot that forms in the blood vessel and then goes off to the brain. Okay, so that is a stroke, like we mentioned before. So just be careful. Okay.
Okay, and the next one on there is high cholesterol. So types of fat hoy that we eat, it gets transferred into cholesterol. So like Dr. Chandni said, the cholesterol can then go to your arteries and then cause blockages, and that can cause a stroke.
And then the last one is a big one, blood pressure. I think so many people that it affects in our community mainly. A lot of us have high blood pressure and we don't know that we have high blood pressure because symptoms now high blood pressure ni. Only when the pressure gets too high do you then think, oh, my matu dukeche, or oh, my eyes are gone funny and mane janku dekaiche. But when it gets to that stage, that means your blood pressure must be really high for it to affect like that. Okay. So that's why a lot of us GPs or a lot of the general practice will send you lots of text messages now. Message karso. You've not had your blood pressure checked in 1 year. You need to come in and have a blood pressure check, or you need to have your blood test taken. All of these checks that we do for your cholesterol, etc., because we want to try and prevent you from having all of these problems like a heart attack or a stroke. It's hard to then, once you've had a heart attack and stroke, it's hard to then try and get all of this under control and prevent you from having another one. It's easier to try and catch you before that. And we want to do that because we don't want any of these complications for you. So again, if you have high blood pressure, it's really important que tame check karo tamara blood pressure regularly. Tamari dawa lo on time. It's really important not to skip 1 day of your dawa, because then you'll find that your blood pressure will go out of range. And it's important to keep all of that under control. And if you've not had your blood pressure checked in a while, please do check it. I think they'll have machines at pharmacies, at your local pharmacy. My GP in my general practice, in my practice right now, we've got blood monitors at the front in the reception area. So you don't have to even go inside and talk to anybody. You can just go and measure your blood pressure. And if it's high, they'll let you know. So it's important to do so. Okay. Then now we're going to talk about, again, I think we've already spoken about a lot of this in what we've just spoken about. But one of the main things, like I said, is we want to talk to you about how do you prevent a stroke from happening. We spoke about what to do if you've already had a stroke, but if you've not had one yet, what can you do to stop it from happening? Like we said, one of the main things is your lifestyle. So we want you to try and live as healthy a lifestyle as you can. It's not, sometimes, you know, we want to be practical about this, because if you have a long job and you work long hours, or you have lots of children at home, you've got lots of people to look after, you're not going to be able to be in the gym for lots of hours of the day, and we're not expecting that. We want a healthy lifestyle. We want a balanced diet as well within that. So when we say balanced diet, we'll touch on that a little bit later. You can see we've got some slides coming up on that and what we can do to try and make that as good as we can. We want you to try and maintain a healthy weight. So I mentioned before that the weight around the stomach area is one of the biggest problems. That's known as central obesity. And actually that weight in that area is the worst, because it actually directly links to the risk of a stroke, the risk of a heart attack, the risk of diabetes. So that is what we want to lower, the tummy area. We want to cut that down as much as we can. Other ways to prevent a stroke is exercising. So this can be yoga, this can be going for a walk in the park, this can be going uphill walking, anything that makes you sweat. Other ways to help prevent a stroke from happening in the future is managing the conditions that you already have. So again, we touched on this already, so I won't talk about it too long. But if you have high blood pressure, taking your medications, checking it regularly, making sure it's below the recommended limit for your age, for your conditions that you have, making sure you're in line. And if you don't know what your blood pressure should be, speak to your local GP, because it will depend upon what medical conditions you have and your age. If you have diabetes, making sure that your diabetes and your sugar level is under control. And again, if you have high cholesterol, taking your medications and making sure that's under control. I think, Karishma, you already mentioned stress again, which is good, because if you have a lot of stress in life, then, and a lot of us do, we all have stress. We want to try and reduce that as much as we can, or control it, because that then leads to high blood pressure. If you're stressed, you might not be sleeping properly. If you're not sleeping properly, you might find that you're up at later times of the day. If you're up at later times of the day and in the night, you're more likely to snack on food that's unhealthy. It's a proven thing, and there's lots of studies on it. you're less likely to eat healthily, and you'll just think, oh, let me quickly eat this because I'm hungry. And you might eat some shak rotli from the fridge that you, instead of having something that has a lot of good vegetables in it, you might eat something that's got a lot of oil in it.
Or ice cream.
Or ice cream.
Ice
Or ice
cream,
cream.
ice
Or
cream.
chocolates.
Chocolates.
Chocolates. Or burfi. So again, it's really important to try and avoid that. And lastly, like I've already mentioned, go for your checkups. It's important.
Oh, yeah, I think Upper Gujarat, Chandni Ben's done a really good job explaining everything. So I think the main things on here, Upper Joano, Upper exercise karano, Upper ma yoga, you know, that's our heritage. That's where, you know, what our ancestors have done. So Upper Joano, pranayam karano, you know, the breathing, the brisk walking, just getting out into a bare jawanu. ને આપણે વજનનું ધ્યાન રાખવાનું બહુ વધારે નહીં હોવું જોઈએ ને ઓછું બી નહીં હોવું જોઈએ because either end of the scale આ બાજુ જાય કે આ બાજુ જાય તો ખરાબ ને આપણે ખાવાનું of course બધું ખાવાનું enjoy કરવાનું life but balance માં રાખવાનું ને આપણે વાત કરી smoking, alcohol, this is no judgment here. This is judgment free zone. So as you feel, you know, in your life you need to do, you do. But this is just from the data, and we've seen patients with these sorts of smoking, alcohol, increased vajan that increase your risk of stroke, all the other medical conditions. Now, Bill je wat karano hoy to really like stress is stress. So one of also the biggest killers is stress, but also sleep. I think Dr. Chandni explained that really, really well. So make sure you have enough sleep. And I think I'll leave that bit at there.
Next thing we have is healthy eating. So this is, again, one of the main things we want to touch on, and we did already touch on this, and we're going to tell you about things that we think you should avoid in a little while as well. But what do we mean when we mean healthy eating? It's so hard sometimes to have a balanced diet and a balanced plate, but this picture tells you everything that we want. So we don't want you to completely cut out. You know, sometimes when you think healthy, you think, okay, I can only eat fruit and vegetables and that's it. And that's all I can eat. That's not what we mean. You need everything in your diet. You do need the fats in your diet, as we can see in, which one is it? It's the sort of, yeah, in the purple one at the bottom. So you do need, as you can see, you still do need a little bit of this in your diet, but we want it to be only that little part of your diet rather than being half of your diet, which sometimes it can be if we're eating a lot of cakes, or say it's a birthday party and there's lots of the table is full of all of this food. You might eat, that might be what you eat for half of the day, and actually that's what we want to avoid. But in small moderation, you need that in your diet. This is what you should be aiming for on a day-to-day basis. So as you can see, we want most of your diet to be fruit and vegetables, which I think we do, you know, in a lot of our curries and things, we have lots of fruits and we have lots of vegetables. Not fruits, but we have a lot of vegetables. But one thing I wanted to touch on in that is how you cook your vegetables. So a lot of people, we find, okay, this is vegetable curry. This has got everything I need in it. This has got my aubergine. This has got my ringan in it. This is my part of my vegetables. But actually, if you put lots of oil over that and then you've cooked it to the point where it's not got a crunch and it's not a little bit crispy, then actually all of the good nutrients in that are gone. So it's really important to look at how are you cooking your food? Are you frying it? If you're having it all fully fried, or you're going to the point where it's not crispy anymore, then it's not good for you anymore. So remember, when you cook your vegetables, a little bit of crunch is always good. And that means it's still going to be good for you and you're still going to have all of the nutrients. As you can see, you still need quite a lot. You need fruit and vegetable, but you still need quite a lot of what we call carbohydrates. That's like bread, rice, potato, pasta. We're good at this because we have lots of rotli and rice, which is all carbohydrates, okay? But what we want you to try and do even in that is how can you make that healthier? Yes, we need it. But it's always good to try and have either sort of brown bread, brown rice, Even with pasta, you can get wholemeal pasta, different types of grain. That's better than just having your plain white rice. It's a little less nutritious. Okay, so trying to have that balance when you can. And again, you do need milk and cheeses, as we said. And if you're not vegetarian, then some meat and fish. But if you're vegetarian, that's fine. Just always making sure you take some supplements if you can for your vitamin B12, etc. Okay, but this picture is what we want you to see. And if you can try and balance that and make it like that, your diet, then that's what we call balanced diet. And we like that.
Mm. And you should also be eating according to the activity levels hoy. So આપણે આખો દિવસ બેઠેલા હોય ને ઘરમાં તો why do you need lots of food? Where is the output? Where is the energy going? ખાલી તમાર waste ઉપર જાય છે અને you will grow out and put on vajjan from that. So eat according to your activity and energy levels. And I know as we age and get older, we might be able to do less, but even then, there's a lot of information also about putting on muscle and keeping that muscle to help, and eating this way will also support that. Okay, so this is just a slide to show some of the food to reduce or avoid if you can, depending on the condition, nakato tamaru medical condition, or tamar vajjan, or tamar personal circumstance. So I'll put we're not saying don't eat any of this. I mean, I love half the stuff on there. So but more about reducing the amount. Yeah. Okay. So on this slide, we wanted this to be a bit interactive. So as we bring up the next item, we would like you to guess how many sugar cubes are in each item. And these items will be commonly used foods. So each cube, one cube is equivalent to 4 grams of sugar. So in a pot of baked beans, especially vagarela beans, which are quite nice actually, how many cubes of sugar do you think they are? I mean, if anybody would like to put their hand up, they can, or otherwise put it in the chat. But this is just to test how much we think.
How much do we know about sugar? So should we have a look in the chat?
Hold on a second, we're going to have to scroll down.
Sorry. 5.
Okay,
4.
Dibabai said 5, Dibabai said 4. Any other guesses? 5 cubes, 6. Cool. Okay. Well, hold that thought. 6. 8. Wow. Okay. 5. Okay. We'll hold that thought because we've got a few more coming. 4. Okay.
Good stuff. Good
Interesting.
guesses.
Interesting. Yeah. Can you all see the next one?
We can't see it. We can't see the next one yet.
1 second. Let me try this.
There we go.
There we go. Pasta sauce. Good old pasta. How many?
Tomato pasta sauce. 2.
2.
10.
Wow. Okay. 5.
Stuff. It's a range, isn't it? There.
There's quite a range.
Yeah.
Okay.
Next one.
What about Coke?
Coca-Cola.
4.
Summer mama. We all like Coca-Cola.
9. Okay. Any other guesses? 7. A lot.
I like that answer.
Yes, there is a lot. I mean, it depends if it's sugar-free or not. No one's actually asked. This is not the sugar-free version. This is the one with sugar. 10.
8, 14. That's a good one.
10 plus. Okay, we'll get back to questions later. Yeah. Right. One last one. before we reveal? A bowl of muesli.
Muesli, like cereal.
How many cubes of sugar will be in muesli? Because we're told it's healthy. But if you look at the back of the packaging of a lot of processed muesli, 10, yeah. Wouldn't be surprised if there was 10 in some of them, not all of them. Okay. Right, thank you everyone for actually participating. Let me just
Reveal some of the answers.
well, these are the answers. So baked beans got 2 and a bit. The pasta sauce is 2. Cola is 3. Muesli is 2. So remember that's 4, 8, 12 grams. That's a lot of sugar.
And I think the most important thing to sort of remember about this slide is how much sugar you should be having in your whole day. So actually in your whole day, you should be having 1 of these sugar cubes, 4 grams of sugar. So if you've had your Coca-Cola drink in the day, that's already 3 times the limit of sugar that you should be having on that day.
Literally, batigu. That's it.
Yeah.
No more food. Yeah. And it's important because we don't always know, or we don't always know from packaging how much sugar there is. So we would encourage you all to, when you do go shopping, have a look at the packaging. Anything that comes in a packet or plastic or paper or anything like that is all processed food. And in order for it to stay on the shelf, it will have sugar or preservatives. So dhyan rakhano ke ketlo sugar apre khai che, and do we actually need it? Because apre that vaste is also bad.
The other thing is when you have your lovely masala chai, which I know I love, you put sugar in it and you put your spoonful of sugar, that's already one of the biggest limits of how much you should be having in your day. So actually being more mindful of how much sugar you're using, when you look at that little small cube that you should be having, you're already having a lot more than you should be when you're having it in just plain sugar. So you need to be careful.
Okay.
Yes.
So we've already spoken about physical activity. So 30 minutes of exercise, 3 to 4 times a week.
Helps to reduce your chance of death from a stroke by 50%. Okay, so I think that's the most important bit, isn't it, on this slide as well, is 30 minutes, yes, of exercise 3 to 4 times a week, but it reduces the chance of death after a stroke by 50%. So that's really important.
And we were talking about mood earlier. I know for people that have had a stroke, their mood can decrease, but also if you're a carer or someone that is in these difficult situations, or even if you're not, exercise can increase your mood through endorphins, and also make your body feel better.
So lastly, again, I think we didn't even realize we've covered a lot of this already before when we were talking about all of the risk factors. But so the things that will happen after a stroke is, yes, we want you to try and prevent having a stroke by being really healthy and improving your diet and your physical activity. But we will also want you to reduce your risk sometimes through medicine, if it's not enough to do it via just your diet or your lifestyle. So what we will want you to do is sometimes, especially if you've already had a stroke or you're at really high risk of having a stroke, we might start you on a blood thinning medication known as aspirin. And now you might know the reason that that's really important, because if a stroke is caused by a blood clot, we want to make sure that we try and prevent a blood clot from happening. So that's where the aspirin comes in. And you might have to take this on a daily basis. Again, blood pressure, I touched on that already, making sure you're taking your medications regularly on a daily basis and not missing one tablet if you can. Cholesterol medicines, we spoke about that. Most commonly, you'll probably take them at night if you're on them. Making sure you take them on time is really important. And again, your diabetes, controlling it if you had this, because like Karishma said, your blood vessels get damaged with diabetes if your sugar is high for too long. And if that gets damaged and your blood vessels are more sticky and damaged, they're more likely to have a blood clot that forms in them. So please be careful.
So તમારા ડોક્ટરને કદાચ તમને દવાઈ આપે સ્ટ્રોકનું રિસ્ક રિડ્યુસ કરવા. એ દવાઈ લોહી પાતળવાનું દવા આપશે કદાચ આપે. તમારા બ્લડ પ્રેશરનું દવા કદાચ આપે. કોલેસ્ટ્રોલનું દવા કોલેસ્ટ્રોલનું ઓછું કરવાનું દવા આપશે. ને તમારા ડાયાબિટીસનું દવા કંટ્રોલ કરવાનું આપશે.
So one of the last things that we wanted to talk about was rehabilitation. So this is after you've had a stroke. What happens after you've had a stroke? And after you've had all of these complications, you might find that you're not able to walk as well as you were able to, or speak as well as you were able to. How do we try and restore some of that function back and give you some of that independence back? So this is, again, via rehabilitation. So this is where lots of different teams work together. So there might be a physiotherapist, there might be the physiotherapist that comes and helps with movement. So we've got one on the screen that you can see. That looks like that's a physiotherapist helping Massey over here learn how to probably try and walk again or try and get some strength in her muscles so that she can try and mobilize again freely. You might notice that you might get a speech and language therapist that can help. Speech and language therapists can help you try and regain some of the strength with the muscles in your face again, getting you to speak as you were, helping you to improve your swallow if you've got a problem with your swallow. So that's important. And then you've even got an occupational therapist. So an occupational therapist is a member of the team that can come to your house and can have a look at how appropriate is your house now. Before you had a stroke, you might have been free walking, able to do everything by yourself, able to go in and out of the shower, able to sit on the toilet properly, all of these things. But actually, after a stroke, like we mentioned with the complications, you might not be able to do that anymore. You might find you can't actually make it up the stairs anymore. And you can't get to the toilet that's upstairs. You might not have a toilet downstairs. So the occupational therapist will come to your home, will assess, is there anything that they can do to make things a bit easier for you at home? They might put railings in so you can get in and out of the shower properly. They might give you a commode, so a temporary toilet at home, downstairs, so you don't have to go up the stairs anymore. These are all things that might help you to at least regain some of that independence and think, okay, at least I can do it this way, and make you not panic as much. The last point we have on there is, yes, those sometimes we try as hard as we can to get some of these abilities back, but sometimes, unfortunately, they are permanent. They're more likely to be permanent if you've had a really big stroke and if you've presented late. So if you've come late to the hospital, or if there's a way that we can't do the treatments that we can, we might not be able to reverse some of that damage. Because your brain is really clever. Your brain, if one part of your brain isn't working, say on the left-hand side, the side on the right will try and learn what your left-hand side used to be able to do over time, over months, sometimes over weeks. For some people, it takes time, but that's what we try and do with rehabilitation.
And there's also support for carers as well. Because although the person who has had a stroke is going through things, their family, their carers will also have a lot to cope with and to support. So remember, that's always there.
Important. Brilliant.
Okay, so for further information, there is a Stroke Association. It is, I think, a national charity.
Yeah.
And there is a helpline for anyone affected by stroke. So that could be the person affected by stroke, it could be the family, the carer, anyone can call them and ask for advice. The telephone number is on the screen in front of you, and there's an email address as well if you'd like to call them. They do have a website, so it's stroke.org.uk, so that's stroke.org.uk. And there's lots of booklets on that website as well. When we were at the Mela Sammelan, last year, the Mela, sorry, Sammelan, we gave out some booklets. All those booklets are available for people of all ages, all backgrounds, all the different conditions. It's available in different languages. There's information for males and females, because their risks can be different.
Mhm.
And I'll leave that on there for a little bit longer, so you could just take in the information that you need.
Or you can take a picture of it if you want to.
That's a good idea.
Mhm.
Take a picture.
Okay. I'm sure these slides are going to, because it's all been recorded, so it will be available on the website as well if you need. Okay. So our last slide is this as well. So we thank you very, very much for listening today. Sorry, we did try a little bit to do a little bit in Gujarati, but our Gujarati is not the best. So it might have reverted to English a little bit, but thank you very much. If you remember one thing from all of our presentation, please, please, please make it be this, because this is the thing that is going to probably make the most change and probably save the most lives, because the quicker you realize and that you recognize that somebody is having a stroke, which is by using the word fast, F for face, A for arms, S for speech, T for time to note it down, the time that they're having the stroke, and to call 999 or to get straight to the hospital, whichever one is quicker. The quicker you do this, the quicker they receive the treatment or you receive the treatment, the less effects that your brain will have and the less damage your brain will have. That means the less complications you will hopefully have. And that means you will still probably hopefully have some of your independence. So all of this is important, and it's a reason, there's a reason for it being important. So please do remember this.
Thank
But
you.
yeah, thank you. That's it.
Okay, so we will go on to our Q&As now.
Let's have a look at some of the questions you've put.
And I'll stop sharing
Yeah.
so you can see us.